And then classes, what all do y'all offer for classes?
So we have HIIT training, which is high intensity interval training. It sounds really scary, but it's not. It's just sort of rounds between strength and cardio all combined into one class. So the idea behind HIIT training is it's a much more efficient way to work out. In the past, we would just go get on the elliptical or the treadmill or go outside and walk for an hour. In HIIT training, we're kind of pushing your heart rate to an elevated level and giving you areas of recovery during the class. So it's going to help you burn more calories while you're working out, but it also puts your body at a metabolic boost 24 to 48 hours after the workout. So you're kind of getting that afterburn effect, having your body work for you the day after, even when you're not actively in the class.
And I know that word HIIT kind of turn some people away, thinking if they're not athletically inclined, or they may be older or may have an injury. But I know from experience that y'all work with people with different injuries, different age levels, that kind of thing, right?
Yes. So HIIT training sounds intense just by the name. It's got high intensity in the name of it. And some HIIT classes will incorporate things like running or jumping, but we only run about 15 people in our class, and our instructor is never working out while the class is happening. We are huge on personalized attention, which means we can modify for an injury, we can work around any limitations a client may have. So everyone really, in my opinion, is accessible to HIIT training in a responsible manner, and you're going to find that here for sure.
Yeah, and just being in physical therapy, as a physical therapist, we never really want patients to fully quit exercise, and we feel like it's really important that you continue to do things just with modifications. So it's real nice to be able to send people somewhere where I'm able to say don't do this, don't do that, and they're able to make modifications during those exercises.
Yeah, it's very important. We see that a lot. If someone has an injury, they're so scared to reactivate the injury. And maybe they go to a big body pump class at one of the bigger gyms, and no one is really paying attention to, maybe their past and, what limitations they may have. So I think it's really important, especially for your clients and anyone else who has a history of some injury, which I think these days most people have something that's either nagging them or bothering them, to communicate that when you come in and know that we're always able to accommodate.
Right. And even though you do make modifications, you're still not affecting the ultimate goal of the class. I mean, you're still getting the same workout. And so a lot of people say, I don't want to go because I'm not going to be able to get as much out of it. But in reality, anything's better than nothing.
Absolutely. And there's so many ways to elevate the heart rate without taking added pressure on certain areas of the body. So you just switch up the exercises or modify, and I promise there's still a good workout that's going to happen.